Doctors say at least 90% of us are slowed down by a headache from time to time. Others have it much worse and suffer debilitating migraines. About 45 million Americans suffer from migraine headaches, and if you have had one, you know how painful it can be. Dr. Payman Sudeji is with the Houston Headache and Neurological Institute to talk with us about migraines and what we can do to get rid of them. That's what everybody wants to know, is how to make them go away. Let's first of all just talk about the difference between a migraine and just a typical headache.
Well, migraine is a very painful situation, and it's a very specific diagnosis. In order to have migraine, you've got to have severe headache. It's usually throbbing. You've got to have nausea, maybe vomiting, sensitivity to light and noise to the point that you want to go to a dark, quiet room. Now, other types of headaches could be very severe, but they're not necessarily migraine. You know, not every severe headache is a migraine.
So many people want to figure out their trigger, and they want to know what it is, but then they have a really hard time narrowing it down. Do you have any words of advice for people to realize what could be causing that headache?
The best way to find your trigger is to write down your headaches, to keep a headache diary, basically. So I always tell my patients, write down when your headache started, how long it lasted, what were you doing when it started. Sometimes when you have the bad headache, it's hard to write those down, but it's really helpful.
What about sleep? I know sometimes people will say, I feel like I got too much sleep, or maybe I didn't get enough. Can that trigger a migraine?
Lack of sleep can certainly trigger migraine. Dehydration is another thing that can trigger migraine. Lack of proper eating. So if you don't eat, or if you eat, you let too long between meals, that can trigger migraine.
Is that a problem when the blood sugar plummets and then you're in trouble?
Right.
Now let's talk a little bit about alternative therapies, because so many people don't want to take a strong medication. We were just showing the neurofeedback. Any other ideas for people who want to just do something different? Well,
you can try physical therapy to the neck and shoulder area, neuromuscular therapies. You got to look at baseline of the headache. What causes the headache? Is it allergies? Is it sinus? Is it? Many times the answer is not just the headache. It's somewhere else. It may be your neck. It may be your sinuses or allergies.
It's something else that's causing it, and you need to try to do whatever you can to figure that out. Like you said, maybe the food diary, sleep diary, whatever it is, to figure what that is. Now, if somebody said, you know what, maybe I will try that type of therapy you're talking about, what would they do to go about getting that help?
Well, you got to talk to a specialist so that they can channel you to a proper person to get that treatment, because you can get the same treatment in different locations and not have the same result. So the people who give you those treatments, they got to know what they're doing.
Dr. Sudeji, very helpful information. We want to keep our viewers headache free, so thank you so much for the advice.
Well, thank you for having me.